Hello everyone, I hope you all are doing well and welcome to my new video. Welcome back to my channel. And today's video is about the charts you will get in the assessment station. So we will talk about the types of charts you will get in the assessment station and how many charts you will get in the assessment station. So before proceeding further, please don't forget to subscribe my channel and keep watching my videos, and please like and share the video. So now let's start with the charts. What type of charts you will get in the assessment station? So mainly there are three charts that you will get in your assessment station to document patients' vital signs that you will conduct. So there are three charts: basic observation chart, news to chart, and neurological assessment chart, which we also call GCS chart, Glasgow Coma Scale chart. So from these three you will get only one. You will never get all the three or the two charts. You will get only one from these three charts, and you will have to document the vital signs of the patient on these charts when you will do the documentation. And you will get these chart according to the scenario or disease condition you will get. Like if you get the disease condition Alzheimer or subdural hematoma, you will get GCS chart, because in this disease condition you have to assess the neurological assessment of the patient. So according to the disease condition or assessment, you will get the type of chart. So let's start with the basic observation chart. So our first chart is basic observation chart. This is called basic observation chart, which is very simple chart we use for the documentation in the assessment to document a patient's vital signs. So firstly, there are patient details. Sometimes these are pre-filled and sometimes you have to fill it. All the details will be given to you in the patient history form will be given to you. You can just copy paste from that details. And if there are pre-filled, there is nothing to do. Then there is a candidate name. You can that is your name. You have to write your name over there. Then there is the year and date. You will write your exam date and year. And then there is a time. You will not put your current time. Like if you are doing the assessment at 4 o'clock in the evening, you will not put 4 o'clock. If you have to put the time which is given to you in your assessment or in the patient history form. You have to put that time which is given in the scenario. If that is 6 o'clock, you have to put 6 o'clock. If that is 10 o'clock, you have to put 10 o'clock. You cannot put the current time. You cannot put the real time. That will be wrong. You have to put the time which is given to you by your assessor in the form, in the patient's history. Then there are the vital signs. They are giving us the signs to put the patient's vital signs. Like they are giving arrow dot arrow for the BP. You have to mention the BP in the same way. They are giving X for the temperature. You have to put X while mentioning the temperature. They are giving dot for the pulse. You have to put a dot while mentioning the pulse rate of the patient in the chart. And for the temperature, they are giving the readings on the right side, but you don't have to put anything on the right side. They are giving that readings in the right side, but you have to just look at the readings and put the X on the left side. All the details should be on the left side. Then there is a respiratory rate. If it is 22, put the 22, 24, 24, just the number. And then your initials. Like my name is Navjotkar, I will put NK. Whatever your initials are, put your initials. And then the documentation of your basic observation chart is done. It completed. So you have to put all the details in the right way. Use the signs they are giving you to use, and if you are not using them, they will fail you. That is not the complete or the right documentation. You have to follow their principles. You have to follow NMC guidelines while doing the documentation. So that is basic observation chart. So our next chart is news to chart. This is called news to chart. You will get this type of chart in your assessment scenario. So again, firstly there are patient details. If they are pre-filled, nothing to do. If not, you have to fill it. Just copy from the details given to you. Then there are date. You have to put your exam date. Then there is a time. Again, you will not put the correct or current time, you will put the time which is given to you in your assessment scenario, whatever the time it is. If it's a time of night, you will put that time. Whatever is given, you have to put that time. Then there is the respiration. Again, you have to put the dot, whatever the observation you got in that box. And then there is a oxygen saturation level, you have to put the dot according to the observation you got. And then if patient is on air, put A. If patient is on oxygen, according to that, put liters per minute and what device he is using. Mostly the patient will be on air, so you just have to put the A. And there is also the scale too for the oxygen saturation level that we will not use in OSCE, so there is nothing to do with that. Then there is a blood pressure, same you mentioned in the basic observation chart. In the same way, from systolic to diastolic, you have to mention the blood pressure of the patient in the given dots, in the given boxes. Then there is a pulse, you have to put a dot according to the observation you got. You have to put the real or correct observation, you have to document correctly. And then there is a temperature. In the same way, you have to mention or document the patient's temperature in the box according to the observation you got. Then there is a news to total, you have to total your the patient's news to and score it in the box. If it is 0, put 0. If it is 2, put 2. If it is 3, put 3. And according to that, you have to put the Y and N in the escalation box. Like if you got the news to score 0, you have to put N, because there is no need to escalate the patient. If you got 0 news to score, if there is a 1, 2, 3, according to that, you have to put Y, that there is a need to escalate the patient to the medical team or wherever you want to refer the patient. Then there your initials, like my name is NK, I will put NK. Sorry, my name is Navjot Kaur, I will put NK. So according to that, you will put your initials and complete your documentation of news to chart. So this was our second chart, news to chart. So let's move to the next chart. Then next chart is GCS chart or neurological assessment chart. This type of chart you will get in your assessment scenario. For example, in subdural hematoma or Alzheimer's scenario, you will get this chart, GCS chart. In this chart, we will do the documentation of the patient's vital signs, and also we will do the neurological assessment of the patient. Like firstly, there is a eye movement, eye opening of the patient. If patient is spontaneously opening the eye, put 4. According to that, you will give the score. Then the verbal response, best motor response, according to that you will give the score to the patient. Then there is a temperature, blood pressure. In the same way we did in news to chart, we will mention or document the patient's vital signs. Then there is a respiration and oxygen saturation. You will just put the number, whatever observation you got while doing the vital signs of the patient. And then there is a pupils size or reaction, right or left, according to that you will put. And then there is a lip movements, and yeah, that's it. So after putting all the things here, you will not count the vital signs like temperature, blood pressure, pulse, respiration, oxygen. You will not count this in GCS chart. In GCS chart, you will only count the neurological assessment score, like 4, 5, 6, whatever you got. Just total it, add it, and put it into the total GCS score, and then your initials. So this is how you will fill your GCS chart. So like how you will conduct your neurological assessment, on this I will make it separate video, because I will tell all these things in the same video. In this video will be very long, and you will not understand everything. It will mix everything. So I will make separate video on all the charts, how to fill news to chart, how to fill GCS chart. Every chart I will make separate video. So in this video I'm just giving you the information like what type of charts you will get. About filling the charts in correct way in detail, I will make a separate video for that. So yeah, that's all about the GCS chart. So these are the three main charts you will get in your assessment scenario to document patient's vital signs. You will get any one of these three, either GCS, either or News 2, or your basic observation chart. You will not get all the three together. There are three more charts: 6CIT chart, PHQ-9 chart, and the third one is must chart. Like if you will get News 2 chart, they can give you PHQ-9 with that. You will also get only one from these three, one from the first three, one from the these three which I'm going to tell you about. So you will mainly get two charts in your exam, one from the main News 2, GCS and basic observation, and one from the other three, PHQ-9, 6CIT and must chart. So like if you will get News 2, they can give you PHQ-9 with that. If you will get GCS, they can give you 6CIT with that. So like this way they will give you the charts. So let's talk about the other three charts. So our next chart is PHQ-9 chart. In this chart you don't have to do anything. Everything will be pre-filled, patient details will be pre-filled, chart will be already filled. You just have to calculate the score and write in the boxes where's the column total box. That's it. You have to do this. You don't have to ask any question to the patient about this. You don't have to do anything with this chart. You just have to calculate the total and write in the box, and when after the documentation, when you will go back to the patient, you can explain this chart to the patient. So this is PHQ-9 chart. So our next chart is 6CIT chart. This chart you will get with the GCS chart. Like this is cognitive behavior chart. In this chart also there is nothing to do, everything will be pre-filled, all the details will be pre-filled. You just have to calculate the score and write in the total box, and after the documentation, when you will go to the patient to explain the charts, explain this as well. So yeah, that's these are the two charts that will be pre-filled. And our last chart is must chart, which is also pre-filled, and sometimes if it is not filled, details will be given to you, BMI score will be given to you, you just have to fill it, and the weight loss score will be given to you, or they will tell you the percentage of weight the patient lost. So you just have to fill it, and there could be one question that you may need to ask your patient, that when he had his last meal. If the patient had his last meal within the 5 days, then you will put score 0, and if a patient is not eating since 5 days or more than a week, then you will give the score 2. So according to this, you will fill this chart and put the sign, date, everything which is given in the chart, and complete this charts. So these are the three charts that you will get with the three main charts. So yeah, that's it. So thank you so much for watching my video about the charts. I hope now it is clear to you what type of charts you will get in the assessment scenario. And to get information about the how to fill this chart, watch my further videos coming soon. And please subscribe my YouTube channel, and don't forget to like and share the video. Thank you so much. Bye bye.